it's Carl McDonald. I'm a managed care analyst at Citi Group. I track all of the publicly traded health insurers and essentially try to predict whether their stocks are going to go up or down. I have a less optimistic view of managed care this year, primarily because they've enjoyed a number of years of slowing medical cost trend. My sense is that we may be seeing signs that that's going to pick up, potentially put some pressure on their margins. Stocks have also currently at peak levels relative to where they've been historically. I'm a little less optimistic about some of the themes that many people talk about, like increased risk sharing between managed care companies and hospitals. I agree that we're going to see more of that over the next couple of years. I would argue, though, it's going to happen at a much slower pace than many people would articulate. The biggest question that I get when I meet with clients, is primarily around medical cost trend. The insurance business is so sensitive to even very small changes in margins that it doesn't take a significant amount of movement there to have a really big impact on what these companies earn. I would say secondarily, the biggest thing that I get asked about from clients is about health reform and specifically health insurance exchanges. So number of people that are going to end up enrolled, whether the plans are going to be able to make any money on that, and then some of the protections that the government offered to the plans, whether the government's actually going to come through on those. Is there a possibility that the insurers could end up losing a lot of money on their exchange business? On the exchange enrollment perspective, I think the likelihood is we're going to end up with 7 million people on the exchanges. What we don't know is how many of them were previously insured versus uninsured. My sense is it's probably going to split up half and half, so roughly 3.5 million newly insured people on the exchanges. In terms of the profitability of the exchanges, I think by and large most companies are going to lose money on their exchange business. There's only one company out there, WellPoint, that has any confidence that they'll be able to earn a reasonable margin on this business. And in terms of the protections that the government has offered plans, I think while some of them are reasonable and the plans will end up with some money, the biggest protection they had, I think the government is going to end up having no money to fund that. So there is a bigger risk than I would have appreciated a few months ago that you could have more significant losses on the exchange business.